first, you try to understand where the fear emanates. A lot of them may describe a past experience or a family story, and you try to really delineate where the fear is stemming from. If it's really the bowel prep, there are a lot of different bowel preps also we can offer patients. We have the classical lightly, that is a big volume bowel prep, but there are a lot of other now in the market as choices like soup prep and movie prep. They are much smaller in volume. So again, it depends, like if it's the bowel preparation, you can give them what options they have. If they're very fearful of even the procedure, a lot of times I would say, let's start with a fit test. Even like, again, screening instead of no screening whatsoever. Let's start with a feed test, and I give them the numbers of sensitivity and specificity of every test, like how sensitive it is to pick something, or the Colorectal test, and just figure out like how we can get them towards a screening option. No question, gold standard is colonoscopy, but an abnormal then stool test, hopefully you can get a patient closer to that gold standard and address whatever needs to be addressed.
I understand that having procedures that involve the colon and rectum can be scary and people feel uncomfortable about it. That's usually a private area of our bodies, especially here in the United States. But it is much better and much easier to have screening for colorectal cancer and not develop cancer, or not be found later to have an advanced cancer and have to be in my office talking about radiation, chemotherapy, and major surgical procedures.
Certainly setting time aside for your colonoscopy or any evaluation is cumbersome, but you need to definitely consider that a non-issue and just follow through with it. I can tell you stories of patients that for one reason or another, they either procrastinated or couldn't get the colonoscopy schedule, and unfortunately by the time it was done, it was too late in some instances.